We are PBS. Welcome to Second Opinion Stat, health information you can use anywhere, anytime, brought to you by the producers of the PBS Health series Second Opinion. Here's your host, Dr. Peter Salgo.
We're talking with Dr. Gloria Vachevitz, an addiction psychiatrist at the University of Rochester Medical Center, and William Moyers, the author of Broken. What do people need to understand about addiction?
That addiction is a biopsychosocial illness.
What on earth does that mean?
That it has biological, psychological, and social components. It's a disease of the brain, but it has effects that range from difficulties in your family to difficulties at the job, divorce, etc.
But, you know, people, when they think about addiction, don't think of it as a chemical disease. They think of it as a failure of the will. I mean, you don't have to take a drink, you don't have to shoot a drug, you don't have to sniff something. What's in the brain that makes you do that, if something that does make you do that?
The brain has a very powerful drive to get rewarded. There's a reward system in the brain that is triggered when you take an addictive substance, especially if you're vulnerable, if you have maybe the genetic background for becoming an addicted person.
I suppose people are now asking, if he never or she never took that first hit of fill in the blank, cocaine, alcohol, anything, then this addiction would not have happened. Isn't this really just a failure of the will?
No, it's not a failure of the will. It's a disease. Addiction is a disease, and getting better involves sick people getting more healthy, not bad people getting good.
What does good addiction treatment look like?
Well, good addiction treatment is treatment that does treat the whole person, that mind, the body, and the spirit. At its essence is a recognition that it is an illness, but that it is an illness with an element of personal responsibility that requires compliance on the part of the patient. Good treatment is whatever is medically necessary, emotionally necessary, and spiritually necessary for that person.
How has this affected you directly? Have you felt the condemnation of society based on your actions, or do you see yourself really as a diseased person?
Well, there's no question, Peter, that as a recovering alcoholic and a drug addict with 13 years of continuous sobriety now, that there's no question that I am what I am, which is in recovery from a disease that has no cure but does have a solution, and the solution is recovery. When I talk openly about that with people, they seem to be a little bit perplexed in the beginning to see that somebody like me can actually become an addict and an alcoholic. This is a disease that does not discriminate. But when I talk openly about it, I find that people then let their own guards down. And usually by the end of the conversation, they're sharing with me their own personal or their own family's experiences with this illness as well.
How big a problem is this in America? If there are addicts that we don't see, the addicts that don't fit the mold that we see on the nightly news of the crack houses and the perp walks and the prisoners and the agents with all their paraphernalia, if there's this big hidden group, how big a problem is this in this country?
It's a huge problem. Perhaps 1 out of 10 people are addicted to some substance.
That's 30 million people.
And I believe it's probably the number one health problem in this country. I know that some of my colleagues in other parts of the medical profession may disagree, but I believe that at the core of emergency room visits, at the core of so many of the other chronic or acute illnesses that people present with, at the core is a problem with alcohol and other drugs.
It's an expensive problem.
It's a very expensive problem. The federal government estimates that $168 billion a year in costs of untreated alcoholism in this country alone each year.
168 billion with a B. You know, Everett Dirksen used to say $1 million here, $1 million there. At some point you're talking about real money.
Real money, and the irony of it is that we as a society, we as a community don't recognize that it is a big problem, but it does have a solution, and the solution is dialogue like this, prevention, research, treatment, and aftercare.
Is there a cure on the horizon, or is it going to be a chronic disease issue for people like William?
It is more likely a chronic disease issue. It is a relapsing disorder similar to many other disorders such as asthma or diabetes, and the cure or the treatment for this illness involves many different sorts of things. It involves family work, involves possible medications. There are medications available for various drugs of abuse, involves groups, involves 12-step self-help groups.
The good news, though, with that is that while it is a chronic disease, treatment does work and recovery is certainly possible.
Well, thank you both very much.
We are PBS.